We have Mychal Manning, who is a local physical therapist in the Stressless. How you doing?
Good. How are you doing?
I am doing well, and I feel it's kind of weird. We set you up in this nice comfy chair, and then we're going to ask you to talk about exercise and getting people out and getting sweaty and doing all these things. So we're going to let you relax while we talk about this.
Okay, we'll try.
So we were joking a little earlier about 5K season, and it's actually something that is kind of a year-round activity in Central Oregon. But as the weather starts to get nice, there are a lot of people who start kind of setting their sights on, I'm going to get outside. I'm going to do something now that the weather's nice. But there are a lot of mistakes people make when they do that.
Totally.
So let's go through some of those.
Okay.
What are the top 5 mistakes that people make when they're thinking about either entering into a 5K or just trying to get out and get more exercise?
I think the big thing is everybody wants to go do these races and they're just like, I'm going to get off the couch and yep, I'm going to go and do it. So they don't warm up. They don't cool down. They're just like gung-ho and just go. Call them weekend warriors. So
that seems like a really bad idea.
For the most part, it is. Everybody's a little bit different. There are those, great specimens that can just do, hey, I'm going to get up and go run a 5K and perfectly fine, or a half marathon. They're great. But most of us can't. A lot of times there's a lot of little exercises that we can do just to kind of prep our body so that we don't fatigue as much. We don't especially get injured. And there's, depending on everybody, it's a little bit different.
So skipping that warm up or that cool down, big mistake.
Totally.
Okay, what's the next one?
The next one is the big one, really is probably the most important, is wearing the right shoes.
Okay.
Everybody's feet are different. If you have a high arch, you need to have a good shoe that you can kind of twist. If it doesn't twist, then it's too stable. It's too rigid. Okay. It's going to aggravate your foot. It's going to aggravate your knee, probably having some low back pain as well. If you have a flat foot, you need something a little bit more stable. So really making sure you have the right shoe for your foot is probably the most important thing.
Well, any type of athlete, every athlete knows you got to have the right equipment. And I think people think of running or walking as something that doesn't need any equipment. But there is this one key piece of equipment that you must have, and that's a good shoe.
Yes, and a running shoe is going to be different than a weightlifting shoe and vice versa. So really making sure that whatever sport you decide to do, you have that right footwear.
So just running into the department store and grabbing that cute pair of tennis shoes might not
probably not the best idea.
But they were so cute.
Yeah, but if
function before fashion in this case,
for the most part. But they're doing better, so you can get a little bit of both.
Okay. Next mistake.
Listening to your body. One of my coworkers has one of the best sayings. She says your body has limited language, limited vocabulary. So when it talks to you, listen to it. So if you're feeling tired or fatigued, or you're running and you're starting to have a little bit of back pain, stop. Just stop for a moment. And sometimes you only have to stop for about 15, 30 seconds and then go again. You're having some foot pain, maybe you have to do a couple little stretches and then return on what you're doing. Or for next time, you're going to warm up a little bit better. Really listen to what your body is saying.
But it's going to tell you. And if you feel great,
keep going.
Then you're doing great.
And sometimes the other thing is our bodies sometimes tell us something a couple of days later. So if, you did that, 5-mile run and you felt great, but the next day you're like, oh, my back, my hip, maybe before you go out, doing a couple exercises or a couple stretches before or after is really the better option.
Like you said, if your body's talking to you, it's telling you something for a reason.
Exactly.
Okay. The fourth mistake.
The fourth one is, so if you're a runner, just doing running. If you're a cyclist, just cycling.
And that's a mistake that they make, is just focusing on that one activity.
Correct.
Okay.
You really want to make sure that your body is nice and strong. When we're doing a lot of running, it's very quad dominant, it's very hip flexor dominant. And sometimes you have to work different muscles to really prep the body to do a really good job, build that more endurance, build a little bit of strength so you don't get injured.
So maybe doing a little strength training.
Correct.
On some of those off days.
Yes.
And instead of going out and running 5 days a week or cycling 5 days a week, mixing in some other exercises in there.
You can even use that as almost part of your rest day. If you're running, 5 days a week and you're taking 2 days off, maybe you just do a little bit of strength training on one of those days.
2 off days.
Exactly.
Okay, so we've got the don't skip your warm up or your cool down. Don't wear the wrong shoes. Make sure you're listening to your body. Don't focus on just that one activity. What's our fifth?
Don't
top
forget
5?
to rest.
Your body
needs to recover.
Frank likes that one. He'd like to have rest days every day.
If you don't recover, then what happens is your body fatigues. If your body fatigues, your body starts to compensate. You're going to have pain, and it's going to prevent you from keep doing what you love.
The tough thing is for those avid runners, and you mentioned cyclists too, really anybody who's really into, even if it's baseball or swimming or whatever that activity is, it's so easy to say, but that's the thing I enjoy. That's the thing I want to do. And if my body can handle it, I should be able to do that 7 days a week.
Yeah. And, I really wish that, you didn't have to take a break, because sometimes it is like a mental thing of getting into that running or swimming or baseball, whatever. But it's really important that if you want to keep doing it for longer, that you're prepping your body to do what it needs.
We're talking with Mychal Manning, a physical therapist with Compass Physical Therapy here in Bend on FM News 100 and 1110 KBND. Now, one of those things you mentioned was that warm up and that cool down. So let's talk real briefly about some of those exercises, understanding that everybody is different. You mentioned that every body is different. So there's probably not a one size fits all stretching routine.
Exactly.
But there are maybe a few things that most people could handle, that most people could do to help.
So I think it's, again, it's just what you said. Everybody's a little bit different depending on what you need. I'm not a huge fan of stretching before, but really important to stretch after.
Okay.
A lot of people want to hold these stretches super long, but sometimes if you just hold them a little bit shorter, but do more repetition, you're not going to wear out the muscles.
Okay.
So everybody is, again, a little bit different. If you tend to have some foot pain or foot issues while you run or do your activity, rolling on your foot on a tennis ball.
That sounds really so painful.
Nice. Oh, it's so good. If you've ever done it before, it's great. But it not just kind of massages that muscle under the foot, but it gets all those bones moving a little bit, which kind of loosen everything up.
Okay.
If you tend to have a little bit of, hip pain or back pain, doing a little bit of what we call bridges. So you lay on the ground. I like to put the toes up, knees bent, and you just lift your hips up, and it kind of gets
get that pelvis up in the air.
Exactly. You're getting your glutes going. You're getting your hamstrings firing. So if you're a big runner or you're doing something that's you're always feeling your quads, this kind of helps balance it out. So you get better, what we call co-contraction, the front and the back of your legs working more equally. Okay.
So those couple simple exercises, but you're saying maybe not focus so much on that before the exercise, but do that after. So the warm up would be more of the warming up the cardio, getting your heart going.
Bridges is a really good one to do before you're doing your activity. Okay. I tend to like to do the tennis ball before, so you're kind of warming the foot up a little bit. You can also do some heel raises, so just kind of coming up onto your toes. If you have a balance issue, make sure you're around a counter or something, just in case. We don't want any falling.
Okay.
So rule number one really is don't fall.
So in the last couple of minutes that we've got, I feel like we could talk about this for a long time, because there are so many facets of this. And the hard thing is, because it's also such an individualized piece. I think we would be remiss to not talk about the injury part of it, because I think that when you're doing running or cycling or any of these repetitive motion activities, it's almost inevitable at some point you're going to suffer some kind of injury. And you mentioned listening to your body. But aside from that, what's the best way to know if we're in that position where, because there's a big difference between, I'm a little sore and, I'm actually hurt.
So usually soreness will go away in a couple days. If it's not getting better in a couple days, or it's getting progressively worse, you probably want to go and see somebody, whether it's your physical therapist, your doctor, chiropractor, anyone like that. Because what you don't want to do is, if you're already a little injured and then you keep going, you don't want to make it worse. If you take care of it a little bit early, it will help you in the long run.
And tell me, you mentioned kind of the different places that people can go. Now, you're a physical therapist.
I am.
But are there times where your expertise would be better or maybe even worse than a doctor? Is there a difference between when we need to call one or the other?
Really, our whole goal is always to work together. We all look at the body in a different way. I'm going to look at kind of movement patterns, and a doctor sometimes is going to look a little bit more specific. It's, there's no right or wrong. We're all just kind of looking at different ways. So no, I think whatever you feel most comfortable with is really it. We all work together. So.
And we are out of time, but for those who would like to get a hold of you guys at Compass Physical Therapy, how can they reach you?
We are right off of 7th Street. next to the new Planet Fitness. And you can either call our office, which is 541-728-0974, or you can go to our website, compassptbend.com.
Thank you so much, Mychal Manning. We appreciate you spending some time with us.
Thank you for having me.
And your expertise. Now, everyone I expect to get outside and get running.
Especially as the weather's starting to get nice, right?
You're listening to FM News 100 and 1110 KBND.